Stephanie Stamis and welcome back to my YouTube channel. Today we're going to be talking a little bit more about putting the baby in the bucket. I've had a lot of questions on how do I do that, what does that mean, and so I wanted to show you some simple exercises to help get that lower back to flatten out a little bit and those lower abdominals engaged. So the first thing you're going to do is against a wall. So you're going to step out. You're about a foot and a half away from the wall, and you're getting sort of into like a wall squat position. So your pelvis is on the wall, and then what you're gonna do is I want you to roll your pelvis up. So you're really bringing your pubic bone up toward that belly button until your lower back is on the wall. If you are someone who's been very forward for a long time, that might be very hard for you to really get those segments of the lumbar spine of that lower back against the wall. But I want you to really think of getting, okay, so I'm rolling to get the top of my pelvis onto the wall, and then that segment of the spine right above that, keeping that there, then the segment of the spine right above that, keeping that there, then the segment of the spine right above that. So we're not sort of like rolling and doing it really fast and not paying attention. There's a lot of attention to what's going on segmentally in the spine. So you're rolling up, you're gliding one segment back, keeping it there, another segment back, keeping it there, another segment back, keeping it there, and really trying to get everything flattened. It takes a lot of lower abdominal work to do this. But if that baby in the uterus and has all sort of flipped forward, then this is a way to try to kind of get it back into the bowl. Just to clarify, this is not how we're supposed to be walking around. This is completely flattening the lower back, and that is not how we're supposed to be moving through space. But it is an exercise to help you get out of this really rolled forward position to moving a little bit rolled back, to really strengthen some of those lower abdominals that help to lift and pull back the baby. And so it can stay within your center of mass, which is within the pelvis, not forward to the pelvis. So we're gonna hold there. Then we can even try to do, if we're getting good at that, we can try to maintain that and then push through our feet and glide up without losing that curve. And so what I see a lot of times is we're here, we roll, and then as we glide up, we start losing it. And so this is something that you can really practice. Roll, get that lower back onto the wall, keep that there, and then slowly slide up. This sometimes can even be a great stretch for your lower back. Until legs are straight, if you can get there, and then slide back down. And same thing. So say we're doing really well with that, then we can add some upper body stuff. So another thing that happens, especially if we've been in bed for most of our first trimester, everything, our head and our shoulders can really come forward. So keeping the lower back against the wall, we can bring our shoulders up towards our ears, roll our palms forward and glide our shoulders down so that they're sitting on top of our rib cage versus forward to the rib cage. And then if you imagine our head just like a turtle, we can bring it back a little bit like a turtle coming back into its shell. And now we're in really good alignment of the upper body. And in this position, we can do snow angels to really open up through our chest. So I'm working hard here. You really are working hard in this position, but it's good for your lower abdominals, good to open up through the chest, and really good for upper back strengthening with the snow angels. So hope that you enjoyed this video. Thank you so much for tuning in.